The one question I have for any agency is why, when I worked, we were not allowed to divulge that a patient, I'm going to call them patients, had HIV. Okay? Now, when you call the coordinators, and I asked them, do you let these women know what they're coming to? Oh, it's against the law. We can't tell them the type of patient that... I said, that doesn't make a lot of sense to me. Because if a young woman gets in here, and my mother's going through one of her bad days, I wouldn't want to be here if I didn't have to. I don't think it's fair to them or to my mother that you can't tell them. Now, I've never read, and I don't know, that it's against the law to tell someone coming out to service a person what kind of... I know I've been told by them that when a person had AIDS, they didn't know before they got there. They only knew from the types of medications. But when a person has dementia or some other illness, you don't tell the women what they're going into? And this is, I think, a part of the problem that makes it that much more difficult for them to deal with the patient and the family. The condition that my mother is in now, not her, she has dementia, but she's still very verbal. She can still reason, but she has 2 hip replacements, and each one occurred while an aide was in the house. They called me each one late at night, and I rushed down from here to the city. I told them to call EMS, and they took her to emergency each time. But of course, no one knows how it happened, but we've had different versions. My mother, and I don't want to just blame anyone, but for her to have had a hip replacement in April and another one in October in the same year, different agency, different people, but it occurred while they were in the house, supposedly watching her. And getting away from that, at that time she had overnight, I guess what you call 24 hours. Now she has 12-12. The women come and go every 12 hours. It's been difficult since we switched over to the 12-12. He's blessed to have someone for 2 years. By the time we've had someone, or my mother's had someone for about 3 or 4 months, for some reason she just feels that they're no longer suitable, that they're doing all kinds of bad things, and she doesn't want them in the house.
I've been coming out here to the meetings here, and it's about 2 years. My wife took sick. She took sick in the hospital, and they've had to put her in the nursing home for therapy. She was there whatever she could stay for the amount that Medicare would provide, but when she was done, she was put out, and she had no place to go. So I didn't know what to do. So we took her home. In the meantime, my sons got involved with it. They were always there with me, and they got in touch with the aides, Westchester aides. Made an appointment, and we got an aide to come to the house. In fact, she came out to the home to meet us, and she come back to my house with me. That's 2 years ago. Now, since then, I've learned a lot about Alzheimer's. And what I did learn was right here in this room here, plus reading some of the literature on it. But what I want to say is my biggest encounter was with the nurses' aides. I had some good ones and I had some bad ones. And now I got a good one, and I'm thanking God that I have her, and she's helping me out a lot. Besides my daughter. My daughter's a great asset to me, and if it wasn't for her, I don't think I could keep my wife at home. The first time I got the girl, she met us at the home. She come with us in my car. We took her home. And when she got home, she was very nice. But then all of a sudden, she was on the phone too much. And I didn't know how to treat them. I was never told how long they can be on the phone, but I got tired of it. So between my daughter and I, we thought we'd get rid of her. So we did. But it come out to be we made a mistake, not knowing that they're entitled to phone calls, but not interfere with the help for the patient, which I didn't know. But since then, I tried to get her back, no avail. She went with somebody else. But when I had her, she wanted to learn the way I cooked. I showed her what I wanted, and she picked up good. And I said, "Boy, I got it made here." But that's the only one. Nowadays, they help. This one here helps me, but she wasn't as good as Josephine.
The first one.
The first one.
Right.
But so far, I've had quite a few. I've had some good ones and some bad ones. But right now, I got a fairly good one. She's been with me going on 2 years, and she helps me out a lot personally, which they're not supposed to do, but she does. And
Well, I had many aides, and starting with the first one, who was a complete horror. I mean, a complete horror. She came in dressed like she was going to a country club, not to take care of a patient. And to prove the point, she was doing her laundry. She wore a robe bedecked with spangles and beads, and she put it in my washing machine. I didn't know why she was wearing such a thing. She's supposed to be an aide, walking around my house in satin pajamas. And I mean, it's not up to me to tell people what to wear, but she puts it in my washing machine, and she broke the washing machine. So I had to get a plumber out. That was the first experience. Then I said, I wish you wear something simple so when you wash your clothes, I wouldn't have to go through that again. So then she was going home for the weekend, and I was waiting for another aide. And she insisted on going. It was one of these terrible days when we had an ice storm, and you couldn't even walk. There weren't even any cars, but she insisted on going to the bus stop to take the bus to go home to have her hair done. Well, anyway, my neighbor drove her down, and my neighbor fell with the car. You couldn't even walk down to the bus stop. And she said to her, "This is ridiculous. The buses aren't even running," but she insisted on taking a bus. So she took it back to my house, and well, what happened after was a disaster. She got involved with a friend of mine who she complained about. She said the friend was doing work that she would be doing for her, like giving Louis a bath and all, which wasn't true. And yet she was befriended this woman, and she calls this woman up, and this woman came and picked her up and took her where she had to go. I mean, she was a terrible person. So I said, you have to leave. So she came back to collect her things with her son and family, and she was leaving with pillow tucked under her arm that I had bought for the bed. And I said to her, I wish you would leave that here. I'm not giving that to you. So you don't know what they do when you're not home. Got a temporary. She seemed fine. They all seemed fine at the beginning. But when you asked them to do something, for instance, one of them was cooking for herself, and she was dropping all the food on the floor. And I said to her, pick it up, otherwise, you're going to drag it into the rug in the living room. She said to me, I don't bend. I can't bend. I said, well, why are you on a case then if you can't bend? You have a man who needs 24-hour attention. She said, I'm not here for 24 hours. She says, I'm here for 12 hours. You'll have to get another aide in. Oh, just take care of him at night. Well, I ended up taking care of this man at night, every night, losing my sleep. And I was told, call the agency, and they said at least 3 times a night, if the man, we had a baby monitor, so she could hear where she was sleeping, she could hear anything that was going on in the bedroom. And I called her, and I said to her, I needed help with Louis. He was falling. She's standing, she had a prayer book in her hand, and she says, I can't come. She says, I'm praying for him. I said, what kind of nonsense is that? You're praying for him. You're here to help me, not to pray for him. I mean, all these silly things, one thing after another. I didn't believe it was happening to me. I thought I was losing my mind.
My husband got sick about 13 years ago. Very, very little, but nobody believes me. So this went on for 3-4 years. Mm-hmm. Nobody sees Nick was sick, so I say, okay. He keep working and everything. By 19, when he was 70 years old, he retired because he can work late. So he retired. As soon as he retired, he started to show all everything falling apart. And we used to go out at that time and everything. But one time we was over some friend's house, and this friend said to us, oh, you know that friend? I say, yeah. The mother have Alzheimer's, and they have AIDS, which is not any good. They look for somebody else. You know anybody in your church? And I said, no, I don't know anybody who does that. So my husband said, what it means, what she said. So I tried to explain in few words what I meant. He said, you mean if I get sick, you let one of those come in my house and take care of me? I said, never. I said, I take care of you. I don't want to say much, so. But then it got worse and worse and worse. So my daughter decided I cannot take care of my husband by myself. So she quit her job. She only worked 2 days home. She take care of my husband 3 days, and the rest I take care. But what it was hard for me was nighttime. He never sleep nights. He don't sleep, but he never open the door and go out. He always stay home. But one ear TV, one ear this, one ear that. So my son-in-law came one night and he said, Michael, you have to promise me, something happened to me, you take care of your mother-in-law. Because every money we have, I give it to you guys. We don't have. Michael said, don't worry about the money, Nick. He always worried about always the money. Money, money, money. I don't know, like he have $1 million in the bank. I don't know, that was his thing. So Sarah Michael said, don't worry about the money. We take care of mom. Like if something happened to mom, we take care of you. That's not a question about it. So my son-in-law said to me, why don't you have AIDS? I said, I can have AIDS during the day. He said, look, Sarah really, she was like losing weight. She was like a crazy. And I was a zombie because I don't sleep night. I go to work and I cry all day. I mean, I work in the store. You cannot cry in front of people. So I just turn around and I cry a little bit. You ask me, how's Nick? And I cry again. It was like bad. Then I started coming over here. I started getting, if you remember, I cry all the time for a couple of weeks. But then I started to get better, and then I ended up to go to the psychologist. So he helped me out. But in the meantime, I said to my husband, I said, Nick, I don't sleep nights. I don't know why, maybe my old age, I don't sleep nights. I say, I like to have no, he said to me, why don't you have somebody to clean your house? And I say, okay, but in the meantime, we was working for AIDS. And we find a beautiful woman. She was from Russia, but she only come at 2 morning in a week. But Sarah say, it's better 2 morning and not at all. So that Monday, Wednesday morning, I took off. On Wednesday, I used to come over here. On Monday, I used to just get out, just have a couple hours off. And they said, she was with us about 6 months. But then Nick started to get very, very, very bad. We cannot take care of him. So, in fact, one time we went shopping, on the way back home, he was picking up the shopping. He fell, we have a little wall. He fell, he ended up in the hospital. And that was the end. He have a leak in the brain, and that was the end. So we took in the Skyview. Just he stayed there a couple of weeks, and then he come home, and then he started again. He started worse. And that time, my daughter said, "Mom, we need somebody more. You have to go to bed somehow." But it took us quite a few weeks to find somebody. We find this woman. I mean, she was okay, like everybody said. They was okay when they first come. Oh, and you know when, because any other lady, the first lady she never used the phone. She never eat with us. And sometimes she used to say to me, Rita, I like when you're home because you cook good, and I like it. She came in the kitchen helping me out. And when I was out, she said, don't you never rush home because I'm not leaving and you're not home. Okay, I said, thank you, I appreciate it. So one day, Nick said, oh, I don't want that. He said, what do you mean you don't want that for lunch? She said, I don't want that. I don't think Rita make that. She said, no, I make. Oh, I try. So eat and eat. And then every time she have to give a pill, he give her Nick's hand, and he said, Nick, that's time for your pills. Oh, okay. She want to give one out of one. She said, no, put everything in my hand. And she talked about the 6 April only once. She give a lot of water. Then she started asking for wine at lunchtime. So I have a cranberry juice with apple, grand grape juice and apple juice mix. And you used to say, oh, give me my wine. And she give a big glass of wine with the ice, whatever. She loved that woman. She take him every morning for a walk. And he said, oh, Lube, I don't want to walk today. Oh, come on, my legs hurt. I have to walk. She don't say to him, you need to walk.
My husband passed on, finally. He had it about 8 years. It was a slow process. In the beginning, it wasn't so bad. One thing he never did, he never walked out. That's one thing he didn't wander at all. On the other hand, he didn't want to go out after a while. In the beginning, I would even leave. I had an art class in Pleasantville. I used to go there once a week. And I would call him. I had a cell phone. I would call him and say, oh, don't rush back. I'm fine. I'm doing good. I would tell him wherever I was. And it worked out beautifully. But that slowly deteriorated, like everything else. Now, to speed ahead, because this is basically about having aides in the house and that sort of thing, I did not go that route. Why didn't I go that route? I thought about it carefully. And I was trying to get used to how he was progressing, how he was changing. And I had to change with him to be able to help him. How difficult I found that to be, to see this man who was so productive and full of life and full of fun to deteriorate. It's changing, and I have to get used to the changes. I found that very difficult. I would get impatient, and I knew that was the wrong thing to do by coming here and talking. You have to have tolerance, you have to be understanding, you're the advocate, and it's all true. But I found that difficult, and I sat down and I really thought about it. I said, I cannot see myself having an aide here who is a different person. Now I have him, he's changing. He is no longer the Frank I know. I have to get used to this person who is coming in, total stranger.
Yes.
So you have to get used to and be careful in the beginning to make sure that you don't hurt them immediately. Ask something that's going to be, off the wall. So I thought about it and I said, as I see it, I don't think it's for me. It's not going to help me with the dealing of him. I had a great problem about bathing with him. He would get very upset. It was like he had a jury in front of him. Why do I, he'd stand there and say, why do I have to get bathed if I don't want to do this? And this whole kind of thing would entail, I couldn't do it. I couldn't bathe him after a while. And even sponge him. So it's an impossible situation. Yeah, okay. And he would get verbally, very upset. And so I said to myself, I cannot see myself trying to have an aide here and have that added problem on top of what I'm dealing with, which is quite difficult for me. I'm only speaking about myself. And I figured that if I have an aide, I have to watch what I'm doing, watch what I'm saying. And so it got so bad that I said, I have to do something. And my daughter said, Mom, you can't keep this up. Your health is going down, which it was. And so they talked me into possibly putting him into the memory support here at Seabury. And I said, okay. I fought it for a while, but then I gave in. And I said, perhaps that's the best thing for him at this moment. And they wrote out they came down. They don't live here. One is in my daughter's in North Carolina, and my son is in Vermont. So they came down, they filled out all the papers, they did a lot of work to get everything done. And then when it came to time to sign, I just couldn't sign it. I just couldn't sign it. So I said, I'm sorry, I know you did all this work. And they were so really very nice about it. They said, don't worry about it, Mom. When you think you're ready, we have the papers, So a year later, P.S., a year later, I said to them, I can't do this anymore because he was starting to get a little violent. So he would threaten he didn't want to go out anymore with me. He wanted to say, well, I can stay here, and he couldn't. He was too far gone to be alone. And so I said to them, it's time. I can't do this anymore.